So we're going to discuss Chapter 3, Community-Based Nursing Practice. So community-based healthcare is a collaborative, evidence-based model designed to meet the healthcare needs of the community. So think public health nursing or clinics when we talk about this. So patients are moving from acute healthcare and hospital-based settings to community-based settings that focus on health promotion, disease prevention, and restorative care. So the focus is on the health care of individuals, families, and groups within the community. Its priority is health promotion. So what are some problems that healthcare providers face in communities? Increases in homelessness, increases in immigrants, increases in STIs, under-immunized infants and children, teenage pregnancies, and chronic illnesses like heart disease and diabetes. So high-risk groups are the most at risk. We know that. We know these high-risk groups are the most at risk, but what types of people would that include? Community-based nursing centers often care for the most vulnerable of the population. Vulnerable populations are groups of patients who are most likely to develop health problems as a result of excess health risk, who are limited in access to healthcare services, or who depend on others for care. You often see a combination of risk factors in individuals. Public and community health nursing and primary care providers share health care responsibility for health promotion, screening, and early detection and disease prevention for vulnerable populations. Interview patients you suspect of being abused. Create an environment that is private without individual you suspect is the abuser. So this would be one example. Provide protection for the ones that are abused. We're going to give them resources as well. So patients who are vulnerable often come from varied cultures. They have different beliefs and values. They face language and literacy barriers. Maybe they can't read and have few sources of social support. So let's make sure that we are not judging or imposing our values on our patients. Rather, educate yourself on different cultures. So, what would you do if you saw a family practicing something that you're not used to, such as acupuncture, or something you're not familiar with? We just want to make sure that we are not imposing judgment or our own values on our patients. To provide competent care for vulnerable populations, you need to assess these patients accurately. Complete assessment of vulnerable populations enables a community health nurse to design interventions within the context of a community. By knowing the community's members, the community health nurse is able to understand the needs of the population and can respond to changes in the community. In the healthcare delivery system, nurses who become experts in nurses who become experts in community health practice usually have advanced nursing degrees. Yet, the baccalaureate prepared nurse, or BSN nurse generalist, is also able to formulate and apply population-focused assessments and interventions. The community health nurse knows the community members, along with their needs and resources, and then works in collaboration with community leaders to establish effective health promotion and disease prevention programs. This does require working with highly resistant systems like the welfare system, and trying to encourage these systems to be more responsive to the needs of a population. What do you assess? How do you assess, what the needs of the community are? Well, you would actually drive around that community maybe, or seek out online information. Community assessment is the systematic data collection on the population, monitoring the health status of the population, and making information available about the health of the community. So, to develop a complete community assessment, take a careful look at each of the three components of the community to identify needs for health policy, health programs, and needed health services. Make sure that you reference page 38, box 3-3. That will give you the community assessment. Once you have a good understanding of the community, perform all individual patient assessments against that background. So what types of skills are needed for the community nurse? Nurses need to develop a solid set of skills and talents to be successful in the community. As a caregiver, a nurse uses a critical thinking approach to apply nursing process and ensure appropriate individualized nursing care for specific patients and their families. The role of caregiver is the public health nurse's priority. Okay, so as a case manager, a nurse establishes an appropriate plan of care based on assessment and coordinates needed resources and services for a patient's well-being across the continuum of care. As a change agent, a nurse identifies and implements new and more effective approaches to problems. As a patient advocate, a nurse provides the information necessary for patients to make informed decisions in choosing and using services appropriately. And then, as a collaborator, a nurse works not only with the patients and their families, but also with other related healthcare disciplines. And then, as a counselor, a nurse helps patients identify and clarify health problems and choose appropriate courses of action to solve these problems. Provide information, be supportive, and help patients reach decisions that are best for them. So, just to kind of sum up, nurses utilize a variety of skills and talents. And if we go through these again, I'll just point out some little snippets of information. So the caregiver, the priority is to use critical thinking. And case manager is to gather resources for the patient. A change agent, remember, finds new and more effective approaches. Patient advocates, we're watching out for the needs and care of our patient, respecting their legal and ethical rights. As collaborator, we're working with families, patients, and other healthcare disciplines. Then as counselor, we're going to be supportive, help patients reach decisions best for them. Educator is pretty straightforward. And then epidemiologists, those especially track incident rates of illness and identify causes of those illnesses. Health professionals provide leadership in developing public policies to support the health of the population. Strong policies are driven by community assessment. For an example, assessing the level of lead poisoning in young children often leads to a lead cleanup program to reduce the incidence of lead poisoning. So back in the 50s, they used to use, and before, they used to use paint that had lead in it. And now we have what's called lead abaters, where they will actually come in, inspect to make sure the home doesn't have lead, but if they do, they'll get rid of all the lead in the house. Identifying evidence-based practices to help more people manage chronic illnesses in the home and the community addresses the needs of nurses and their patients. Improved access to care ensures the essential community-wide health services are available and accessible for the total community. Okay, quick quiz question. Vulnerable populations of patients are those who are more likely to develop health problems as a result of. The answer is abusive habits.